Hey everybody, I'm Dr. Marianne Pinkston and welcome to The Better Life with Dr. Pinkston. I am alone at the mic today and have a great topic for you. This is something that I cover in my clinic often. And by often, I mean I check almost every single person that walks through the door for this common issue called MTHFR. Now, MTHFR, this is not a very simple topic, so bear with me for just a moment, but I think it is probably one of the most important topics that there are out there. Patients many times go to their physicians and have common issues, things that I have suffered from before. They sit in front of their physician and talk about these issues and how they feel. Many times doctors are looking for a simple solution of a pharmaceutical, something that they can, just hand you and say, this is what it is. We're going to prevent disease down the road. You see a lot of commercials of biologics and medications and things with a lot of side effects. This problem is a problem that covers many, many symptoms. So if you have trouble with brain fog, if you feel like, you are stuttering your speech, you can't find a word, you walk into a room, you can't remember why you went in there. If you struggle to communicate effectively, this is something that happened to me not too long ago last year, and I had trouble sitting down at the mic here with the radio and trying to, get my words out, get my thoughts across. If you have a lot of fatigue, and it's not just feeling tired, but you can start your day and feel like you're going a little bit, but your muscles just don't want to go. Your brain doesn't want to go. It's more than just feeling down and tired. It's just your body is not responding and working with you. That fatigue is true too, because you do feel sleepy and unable to get up and get going. But there are so many other issues. You can also suffer from heart disease, dementia. There are many, many problems and diseases that are linked to this. Many women get a lot of palpitations. You are running on adrenaline, which is like on gas fumes, and there are things like depression, autism, ADHD, adult ADHD-like symptoms come with this. So MTHFR, and what is it? So MTHFR is a gene. It is a gene that we are supposed to have that makes an enzyme. This enzyme processes folic acid in our bodies. When you take in a vitamin with folic acid, your B vitamins, and it has folic acid in it, your prenatal. When you eat a meal and your vitamins are supposed to be in your foods like folic acid, well, folic acid has to be processed into another form. It has to be converted into methylfolate. And methylfolate then is the activated form that your body uses to do things like make your brain chemistry. So bear with me a minute and go back to high school biology. When you had, high school biology and you learned about all the cells in your body, your cells, nice little round or square structure. In the center, it has the little round nucleus that contains all of your genetic material, your DNA. And then there's another little organ or organelle that sits beside the nucleus called the mitochondria. The mitochondria is in every single cell, and it is basically the engine. So I call the nucleus kind of the brain, and the mitochondria kind of the engine. And it produces the gas that your body needs to run every single second of every single day for everything it does, from breathing to thinking to moving, whatever it is you're doing. And all of those cells, you got billions of them, and collectively, all of those mitochondria make a substance called ATP. And when ATP is produced, that is what your body efficiently runs on in order to think and move and act and breathe and do everything that it does all day. Whenever your mitochondria let's step back, whenever you're unable to make this enzyme, you're missing the gene, the MTHFR gene. About 50% of Americans and people in America are missing this gene. They don't make MTHFR or that enzyme. Therefore, they don't process folic acid. They don't make their brain chemistry. They don't make ATP. And so your body is unable to perform all of those tasks. When we're young, we can kind of compensate for it. As we get older, we cannot quite as well. It begins to show. So if you're not able to make ATP and the energy for your body is going to have to get its energy from somewhere. So what does your body do? It runs on adrenaline. So your adrenal glands pump out cortisol or stress hormone or adrenaline, and that is what you have to think and breathe and work and do everything you're supposed to do. And that is very inefficient for the body. The body thinks that it's running from a bear constantly. So you're constantly, on edge and full of adrenaline. You're just focused on, getting tasks done and surviving, but you're not really focused on that relaxation side where you have the energy to do what you need to do and think straight. So it is like running on gas fumes. And many people feel revved up. They don't sleep well. Their heart races. They have palpitations, things that are very unexplained. Again, you have that adult ADD-like issue where, you just can't focus, you can't think straight, you can't find words. Very, very difficult to communicate this way. But it leads to far greater problems. And that is where there's an increase in heart attacks and strokes and cancers. There's an increase in ADD and autism being born with those issues. There is, so many factors. Dementia, Alzheimer's is absolutely one of the largest things that we are finding. And you can very easily find MTHFR. It is a blood test. So when you get the blood test, you're looking for two different SNPs, what we call SNPs, two different genes that could be affected. One is called 677 and the other is 1298. You can have each chromosome has, two pairs with it, so you can be affected by two of each pair or one of each or just one on one single one. But regardless, all of those are, stages of how you are affected. So the more that you're affected, the worse issues you're going to have. If you're not greatly affected by it, then sometimes you can just look at some foods to replace your folic acid and just increase your folic acid, increase your B12, and try to overcome it in that regard. Most people, though, when they take a vitamin, can't overcome it. So you can take all the folic acid in the world that you want to, and it is not going to help. So you have to take a special version. You have to take the folate that is already methylated in a process in your body does called methylation. So methylfolate or even methylated B12. Whenever you take these vitamins, though, I warn you to be a little bit cautious. You can overdo it. So I know if you're feeling terrible and you're having a tough time, I did this myself, actually, because I do have this gene. And again, I told you a year ago, it affected me greatly. And so I started the methylfolate, very easy, take one capsule a day. But I thought, well, if I feel this bad, maybe I'll take more. So I took 2 or 3 for a couple of months. Wound up overdoing it, so you can overmethylate. Please don't do that. And I know folks out there are looking for a good version, and I am associated with a great team, a great pharmacy that does make a version. It is over the counter, and you can find it in many pharmacies and online, Amazon, all of that. But I encourage you not to do that because the version that you are looking for needs to be a certain dosage and a certain stage. It needs to be that final form. It doesn't need to be a form just before, you get to the final form, which might be a little cheaper in some aspects. But I found something that is very reasonably priced. It's called Denovo, Denovo. And you can go to magnaweb.com, which is where Magna Pharmaceuticals, one of my sponsors actually, and they're my sponsors for a reason. No, I am not selling this product, but magnaweb.com is, and Magna Pharmaceuticals, Dr. Lesser over there is a wonderful pharmacist who created this version, very safe, effective, the right dose, very clean. And so I encourage you, it is not expensive. I think it's about $25, $29 or so, depends on how much you buy for a month. And you just take one a day. You do have to take something like this for the rest of your life, though, because if you never process folic acid, you're never going to. You're missing the gene. So again, I mentioned that there are some foods that you can use to try to overcome this yourself. And so I tried to look at my list here, make sure I get it correct for you. But the beans and lentils, leafy green vegetables, things like the cruciferous vegetables, broccoli, avocados, and all the bright colored fruits and foods and things do help with that. One thing I want to talk about for a second, though, is the fact that, because I've missed a very, very important part. If you remember, I said you also don't make your brain chemistry. So your body has, it has its brain chemistry. It's not actually made in the brain. It's made by your gut. We've talked many, many times about how leaky gut affects depression, anxiety, and mood disorders. But guess what? This is an even larger cause underneath. So if you don't have the methylated folate, you're not making your brain chemistry, then people who have MTHFR suffer greatly from depression, anxiety, and mood disorders. I had a man that came to see me, he was 22. So he came to see me in clinic. Out of the blue, normal childhood, developed many signs of schizophrenia. Became very, very severe within a year, very severe. When he got to the clinic, we tested him. Again, it's a very easy blood test. We tested him. He was positive for both SNPs on both genes, very severe. And we got him started within 6 months. The schizophrenia was gone and he was back to normal. So am I promising that this is the end all be all and going to cure all of your ills? No, absolutely not. But if you are like many of the patients and like me that come to my clinic, I have seen so many people suffer and not be able to pinpoint why they're suffering and find a good solution. They get many, many lab tests, get many scans of the head, many studies, heart scans, and nobody can really find an underlying cause. This is a very, very simple cause, a very simple solution, and it needs to be tested before you jump on tons of diagnoses and medications and things that, can pin you lifelong, like antidepressants or, heart medications to slow your heart rate down or to stop the palpitations. There's so many different things that docs can put you on when really you just need a vitamin supplement. Something I'll mention as well, if you are taking medications, like if you are like me, rheumatoid arthritis, you take something like methotrexate, you don't use your folic acid, and you don't make the methylfolate correctly. Something also that's very, very common that suppresses your folic acid is metformin. So for all of you guys who have PCOS or who are using it for weight loss or for diabetes, metformin can actually do the same thing. So you have to take folic acid replacement. If you have MTHFR, then you're going to be dual hit and really will cause you some significant issues. So with the other medications that affect it as well, birth control pills, anticonvulsants, NSAIDs. So if you are taking things like Advil, Aleve, aspirin, that can also cause issue, chemotherapy, cholesterol medications. There's so many meds. So if, take a look at draxc.com. There's a great article on MTHFR that I tend to give my patients, but also ask people to look up online. So draxe.com, drax.com. Look up MTHFR and you'll find a great article there. As far as, taking vitamins and things like that, again, I want to reiterate, if you go and you look for something that is over the counter, can just at the store, Amazon, just be very, very careful. Quality is everything. And so again, I'm going to send you back over to magnaweb.com, Magna Pharmaceuticals, and look for De Novo. There is a prescription. It's called Deplin. You've probably heard of it. But it is very expensive, and many insurances do not cover Deplin or cover the methylfolate that is needed. So I invite you, please go take a look at these guys and look them up. De Novo, magnaweb.com. So on MTHFR, one of the last few things I want to mention too, said that you have to get a blood test. It's a one-time blood test. You don't have to repeat it. So you're not actually looking for levels. You want to see if the gene SNP is there. If you're positive for it, you're always going to be positive, so you don't have to repeat it. There are ways, though, of knowing how you are managing the lack of the gene and the lack of folate. Homocysteine. So I check homocysteine levels in my clinic, and I have for a decade or more. And whenever homocysteine is a byproduct of the process of using folic acid in your body, the methylfolate. You need a little bit, and you don't want too little, and you don't want too much. So there's just that fine amount that you need. And that is, we're able to follow those levels. Generally, I'll keep people around, 3 or 4 to about 9. I'm a little bit stricter than most doctors on levels. So get your homocysteine checked. It's generally covered by insurances. You can check it every 3 to 6 months, and that will give you an idea about how your folate level, your methylfolate levels are doing. You can check your folic acid levels or folate, and a lot of doctors do check your levels. But remember, you can have plenty of folic acid or folate in your body, and you can have skyrocketing levels, and you're doing nothing because you're not converting it. So don't use folic acid levels as a guide as to whether you are methylating or whether you're using this appropriately, but rather use homocysteine levels, and that can help keep you in the ballpark. So I need to mention another one of my sponsors, Pinnacle Research. So Pinnacle Clinical Research Texas is here in San Antonio and in South Texas. They screen for fatty liver, and you can get a free FibroScan. You can sign up or schedule yourself in at pinnacleresearch.com and go over. It takes about 10 minutes. It's free. Somebody actually will sit and give you a consult on, what your results are and how to get started, at least for therapies. And then Pinnacle Research also does research, of course, but it is not kind of your back of the, underground basement research, things that they're just being guinea pigged and trialed on people. These are actual wonderful, internationally renowned physicians who are doing some fantastic work, and everything you would do over there will help somebody else. But fatty liver is incredibly important. Go to pinnacleresearch.com, get scheduled for your FibroScan. Then I want to mention Magna one more time, magnaweb.com. Dr. Lesser and De Novo, and plenty of other things that they have too. They have omegas, and so you can get your fish oil, very high quality, many other products. So please check out magnaweb.com. Also, I want to mention that you can check out a lot of my other podcasts and a blog. I've got a great website. Go to drpbetterlife.com. Not only am I here on San Antonio radio, but I am all over the U.S. and I guess internationally too, with a great podcast and YouTube. Please check it all out at drpbetterlife.com. I'll have plenty of information on the MTHFR and on where to find De Novo and other sources. So please take a look there. When we come back, I'm going to take a short break. And when I come back, I want to talk a little bit more about how this affects heart disease, because heart disease is still the number one killer, despite having all of the, cardiologists with all of their high-tech testing, statins, and all these things we take. Guess what? It's still the number one killer. So we'll talk about that again in just a few minutes. Be right back.
Fatty liver is linked to two different situations, alcohol and diabetes or obesity. In both cases, patients can have no symptoms. In the United States, and in particular, Texas, the most common cause of liver disease in general is non-alcoholic fatty liver. Again, associated with overweight, obesity, and or diabetes. Additional risk factors include high cholesterol, high blood pressure, Hispanic ethnicity, and postmenopausal status. At Pinnacle Clinical Research, we offer a quick, non-invasive ultrasound-based screening assessment called FibroScan. This test is done at no cost to you, and we do not take insurance. The test will measure the fat and stiffness in your liver and stage your risk and development of fatty liver disease. You will meet with a provider immediately following your scan to go over your results. If you're interested in getting more information on your liver health, please call 210-529-7978 and schedule your FibroScan today. We are conveniently located in the Medical Center at 5109 Medical Drive.
Depression, anxiety, low energy, weakness, these are just some symptoms of low B12 levels. And the absorbable B12 folate supplement that's helping people declare victory over depression symptoms is De Novo Plus B12 by Magna Pharmaceuticals. Patients with symptoms of depression often exhibit low levels of folate and vitamin B12. The human body needs sufficient folate intake to produce the essential neurotransmitters serotonin, dopamine, and norepinephrine. These neurotransmitters alleviate feelings of sadness, anxiety, and gloom. What makes De Novo Plus B12 so successful? De Novo Plus B12 contains readily absorbable folate and B12. That means it's more successful at correcting the root cause of your deficiency, not just the symptoms. Whether you are suffering with low energy, depression, fatigue, or anxiety, you owe it to yourself to learn more at magnaweb.com. That's magnaweb.com. Please let us know at checkout that you heard about De Novo Plus B12 on The Better Life with Dr. Pinkston.
Hey everybody, welcome back. I'm Dr. Marianne Pinkston, and this is Better Life with Dr. Pinkston. We've been talking about MTHFR. MTHFR is something that is very profound when it affects people. It comes in all degrees from, not so bad, not so noticeable, all the way up to extremely severe. So, one of the things that I do test for is the heart disease. Heart disease, again, is the number one killer in the United States, and we are trying to do more and more these days to affect it. One of the tests that I have been doing at my clinic and advertising quite a bit is called an MCG, or a multifunctional cardiogram. It's a 10-minute EKG, but way more in depth. That will make EKGs obsolete, because what it can do is tell you exactly what is going on with your heart, what your risks are. It can tell me which artery is affected by heart disease and how close you are to get to having an MI or a heart attack. It can tell me how to treat it and prevent it. And so one of these preventions is actually treating MTHFR. Now, I realize that there are many who don't feel well and have a very difficult time with fatigue and getting through their day. It can be so severe that patients wind up on Adderall and lots of medications that are both addicting, but also make their adrenaline issues worse. So, like I said, you are running on adrenaline. You are not running on natural energy. It's very ineffective, like running on gas fumes. When you are on adrenaline, your body thinks about nothing else except for being on fire all the time, and like in survival mode, like you're running from the bear. So you really don't have time to, your body to process its hormones and all of its functions that it needs to work normally. Well, one of these functions is actually to reduce inflammation. Now, inflammation can occur in the brain, which is where the dementia and Alzheimer's come from. It can occur in the arteries. And so when it occurs in the arteries in the heart, then you get a buildup of cholesterol on the inside of those arteries, which is what leaves you at risk down the road for having a heart attack. There's many, many other issues that it causes as well, but heart attacks and strokes, again, is the number one killer in the U.S. So what we can do is do this MCG, and I can find all of the factors. There could be up to 10 or more factors that are involved in your underlying heart issues, and MTHFR is one of them. And guess what? Within a week or two of taking the correct methylfolate, you can actually turn a majority of that disease around and get into a reverse mode and reduce your risk of heart attacks and strokes, dementia, and those other things. Again, I mentioned that it treats depression, ADD-like symptoms, and many patients come to me and have said that they didn't really have problems when they were younger, but now that they're in their 30s, 40s, 50s, they feel like they can't focus, and again, lack of energy. They just feel like they have ADD. ADD doesn't occur in your adulthood. There's a reason for it, and many times this is occurring underneath. I treat with a vitamin, and I tell people really what to expect. That it could take 2 weeks, 2 days, 2 weeks. It could take 2 years for your body to resolve this whole issue. If you're older, it's been going on a very, very long time. So we have to start somewhere and rebuild the tank, or fill the tank and rebuild your stores. And then you have to start living off of it and repairing. So sometimes it can take a while, but you don't want to overdo it and take too much to really get jump started. I promise you, within a couple of days to a couple of weeks, you will notice a difference, even if it takes some time. I started about 10 months ago, and within 2 weeks, my brain was already working. I was back on radio doing my thing, but it's still 10 months out. I still notice sometimes I have, the palpitations and things like that, or have a rough day, but it really depends on the demand. I treat patients also for adrenal disorders at the same time. So not only do we use something like de novo or the methylfolate of your choice to treat this underlying condition, but we also need to treat the adrenaline issues that are going on. So, there's a dual thing. And when you look at this problem, it's your body and your all the diseases and things that you're suffering from. It's like a 500-piece puzzle, and all 500 pieces matter. MTHFR is just one piece. Of course, it's linked to 499 other pieces, but it is one of the pieces. You have your adrenals, you have thyroid, those are linked very closely. MTHFR then falls into that. You have just your generalized nutrition and hormones. There's so many factors. So MTHFR is a deep, dark, very important one, but it is not all of it. So don't expect it to fix everything. So there you can find more information about MCG on some of my past shows. You can also go to my website, but you can call my clinic at 210-698-7825, which is on my website, please. You can go to drpbetterlife.com. Just hit the contact form. It actually all comes to me. I answer all my own emails. So send me some information on you and what you would like to know about in regard to MCG or to MTHFR, and I can send you information. You can call the clinic 210-698-7825 and get scheduled for an MCG. It is not insurance covered because it's good for you. Why would it be covered by insurance? It's generally $425 to do, but if you have friends or family, this is what the company charges. But if you have friends or family or people that you want to get a small group together, please do so. That they can drop the price for a group rate. And this is something very, very important to your health. When you go to your cardiologist, you're going to spend anywhere from several hundred to several thousand on your deductibles or whatnot, getting a ton of testing that won't tell you a tenth of what this test can tell you. This is a real lifesaver. Please, I encourage you. So again, you can go look at all my previous shows. I have almost, probably, 150 of them now. I'm not sure exactly how many I have, but we have a lot. drpbetterlife.com, my blog, plenty of information, and you can find all of my links to social media. I would love to have you check us out on social media as well. And drpbetterlife.com. I also want to thank Pinnacle Research at pinnacleresearch.com. You can get your free fiber scan, and Magna Pharmaceuticals at magnaweb.com. And you can find more information there. I also mentioned Dr. Axe, DRAXE.com, where you can look up MTHFR and some good reading material. So everybody, thank you very much. I hope this is a huge solution for you, as it was for me. We are going to turn around and have a new show next week. Please join me, and I appreciate all of you watching out there.